Hi, welcome to another video from Autism Advanced. Today I will talk about 4 common signs of autism in children. Before we begin, please take a second and hit that subscribe button below, as I will be creating weekly videos that will provide you with information that can make a difference in the lives of those affected by autism. As I mentioned in my previous video, autism is a neurological and developmental disorder that affects social interaction, communication, and behavior. Autism is most effectively managed when the condition is diagnosed and treated with behavior therapy at an early intervention. Learning the difference between typical behaviors, personality traits, and those that may be autism symptoms is a challenge, but it can have a big impact for the children on the autism spectrum. The signs of autism can often be observed in early childhood, and with this video, I will try to help you recognize them. A common sign of autism in children is often delayed or absent speech. Children with autism may not babble, point, or use gesture to communicate. They may also have trouble understanding and responding to verbal communication. Delayed speech refers to a child's inability to reach the normal development milestones for speech and language. For example, a typical toddler will usually start to say their first words around the age of 12 months and start to use two-word phrases by 24 months. Children with delayed speech may not reach these milestones at the expected age. A typical toddler will start to babble around the age of 6 months. They will produce a range of sounds such as baba, mama, and dada. A toddler with delayed speech may not babble at all or may produce very few sounds. They may struggle to communicate basic needs and wants. For example, they may only say a handful of words or use gestures to indicate what they want. Some children with ASD may have echolalia, which is the repetition of words or phrases that they hear. They may repeat something they heard on TV or from a family member, but they may not understand the meaning behind the words. A toddler with delayed speech may have difficulty following simple directions such as come here or put the toy away. They may not understand what is being asked of them or have trouble processing the information. Last, they may not respond when their name is called or have trouble engaging in conversation with peers. Another sign of autism in children is a lack of social interaction. Children with autism may not seek out social interaction with others or respond to social cues. They may also have difficulty making eye contact or engaging in play with others. A typical toddler will usually make eye contact when interacting with others. However, a toddler with ASD may avoid eye contact altogether or only make brief glances. Children with ASD may not respond to a smile or a wave from someone else. They may not understand the meaning behind those gestures or may not know how to respond appropriately. A toddler with ASD may prefer to play alone or engage in repetitive behaviors instead of interacting with peers. During a social interaction, a child with ASD may have difficulties with taking turns. For example, they may not understand when it's their turn to speak or play, or they may interrupt others without realizing it. A toddler with ASD may not engage in imaginative play or pretend play. They may not understand how to engage in make-believe scenarios or may not find them interesting. Children with ASD may not look to others for guidance on how to act in a social situation or may not understand social norms. Repetitive behaviors are also a common sign of autism in children. Children with autism may repeat certain actions such as flapping their hands, finger flicking, body rocking, or spinning in circles. They may also have specific routines or rituals that they follow and become upset when those routines are disrupted. A toddler with ASD may become intensely interested in a particular topic or object and focus on it to the exclusion of other activities. For example, they may be obsessed with a particular toy, type of vehicle, farm animals, dinosaurs, letters, numbers, and so on. Children with ASD may engage in repetitive play such as lining up toys, sorting objects by colors or size, or repeating the same actions with toys. Some toddlers with ASD may develop echolalia, which is the repetition of words or phrases that they hear. A child on the spectrum may become upset or anxious when there are changes to their routine or environment. They may prefer to follow a strict schedule and become distressed when things do not go as planned. A toddler with ASD may engage in repetitive behavior as a way to self-soothe, reduce anxiety, or regulate their sensory experiences. Last, sensory issues can also be a sign of autism in children. Children with autism may be sensitive to certain textures, sounds, or smells. They may also have a high tolerance for pain or not respond to pain in the way that you would expect. Sensory issues can range from mild to severe and can significantly impact a child's daily functioning. A toddler with ASD may be hyper or hyposensitive to certain smells, sounds, or textures. Some children with ASD may have a hypersensitivity to certain textures such as cloth tags, certain fabrics, or foods. They may avoid wearing certain clothing or eating certain foods because of their texture. They also may be overwhelmed by loud noises such as firework or thunderstorm and cover their ears, cry, or become agitated in response to loud noises. Other children with ASD may seek out more intense sensory experiences. For example, children with ASD who are hyposensitive to touch may seek out rough play or crave deep pressure, such as jumping on a trampoline, crashing into furniture, or hanging, squeezing themselves tightly. They may seek out loud noises, yelling, banging on pots and pans. They may not cry or react when they fall or hurt themselves. It's important to note that not all children with ASD will exhibit all of those signs, and some children may exhibit different signs. However, if you notice any of these signs in your child, it's important to talk to your pediatrician and to get an evaluation and determine if early intervention is necessary. With the right support, children with ASD can learn to manage their symptoms and develop skills to improve their daily functioning, leading to a better long-term outcomes. I hope this video helped you to better understand some of the most common signs of autism in children. If you have any questions, please type them in the comments below and I will do my best to get back to you. Thank you for watching. I'll see you in the next video.